Guys, welcome back to Medical Coding with Blue. Today's episode is all about how to increase your production speed in medical coding. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so production. Let's talk about this. Now, different employers have different standards for what they consider to be successful production for medical coders, okay? But what you have to do first is know if your facility or your doctor's office has a reasonable amount of production that they're requiring of their coders, okay? If the production is anywhere between 80 and 150 in a day, average for outpatient coding, okay? Not inpatient, okay? But outpatient coding, then you know you're doing good because that's sort of the average. 150 is a lot. I'm not going to lie. But there are some clinics that are sort of repetitive, so it's a little easier to get to 150, all right? Now, if you are working in a specialty clinic that requires a little bit more specialty knowledge, like orthopedics or podiatry or cardio or, any neuro, any of those, that number is going to be a little bit smaller, like more reasonable. Typically what it is, I've seen it at 90 because myself at my facility, I work in a specialty clinic and that is where my production standard is at 90 per day average, okay? You're not always going to hit your average for the day. Sometimes things come up and that's when you put that stuff on your workload report, and basically you're letting your employer know what you've done that day that wasn't related to coding, okay? So let's start off there. Anywhere between 80 and 150. Some places might be lower than that because they have a little bit more deeper specialty or something else that's going on, okay? So there's just a lot of variables, but that's really an average, all right? And now when it gets higher than that, let's just say that at your facility, they want 175 average per day, they want 250 average per day, they want 300 average per day. That's not medical coding. That's data entry, okay? And I would recommend that you keep working until you find another job, okay? Because that's not medical coding. That's data entry. There's a lot of employers that think erroneously, especially because if they don't know anything about coding, they say, well, the electronic medical record is doing all the code selections. It has to be right. So we just need people to push these claims through and we're just going to make them produce. And, we don't care because the system's already doing it. Well, meanwhile, the system doesn't always do it correctly because artificial intelligence does not have critical thinking. That's the difference between artificial intelligence and humans, is that there's no critical thinking when it comes to artificial intelligence. Therefore, it can confuse a lot of things. Now, I've seen it myself with the computer-assisted coding where the provider had documented something about the fall. Well, he was referring to the time of year in the fall, like the autumn, right? And the computer-assisted coding was trying to say that there was an injury there. There's no injury, all right? He was just referring to the season. So there's a lot of things that artificial intelligence will never have, and that critical thinking is one of them. And so if your facility is really dependent upon the electronic medical record because they don't have enough faith in the coding staff that they're actually doing the coding correctly, and they say, well, the provider wants this code and the electronic medical record says it's okay, or the system says that it's okay, so you just push it on through. Wrong. As medical coders, we have the ethical duty and responsibility to ensure that the codes that are being selected are actually correct and that they're not, that the codes that are being sent through are reflective of what is going on and not something that's not there, right? So that's the thing that you have to know first and foremost. So let's just say out of all that, you have a reasonable production standard. Let's go with 125 average per day. Okay, 125. So not too bad, a little on the high side, but again, now we have to look at environmental factors. Are you having a lot of distractions around you? Are you in a room with a bunch of other coders? If you are, I really highly recommend getting a set of headphones. When I worked in a horrible, horrible tin can of a room, and I say it was a tin can of a room because there was 20 of us in there, like cattle. We were all just housed in there. And there was so much talking, and it just gets very aggravating when you're trying to think and people are laughing or, just, talking and just won't be quiet, So I went through many sets of headphones the years that I was in that tin can of a room. But now that I have my own office, I can just close the door, which is nice because then I can really concentrate on what I'm doing. So if you're in a situation like that where you're in a communal office, you want to make sure that you have your headphones so that way you can just listen to music or just have that noise canceling so that way you can concentrate on what you're doing. And that may help you, okay? If you are brand new and you are starting, don't start panicking right away if your production is a little lacking, okay? Because it takes a while, a minute, hot minute, to get to learn the electronic medical record, all right? Every one of them is different. It's impossible to really learn it beforehand, okay? Unless you're experienced with it some other way. But it's really sort of impossible if you don't have a reason to be in those electronic medical records, because even like the demos that you can see on YouTube, I mean, it may or may not be similar to what's at that facility, because even big companies like Epic have different packages for different facilities depending upon what they bought in their package. So because of that, it's not always going to look the same. So don't be too hard on yourself, all right? If you are learning to work with the electronic medical record, you have to give yourself some time. Try not to panic if you feel like you're going too slow. Everybody starts brand new. Everybody has to learn this stuff. And you being a brand new coder, there's just things that it's going to take some time. But they will expect you to be steady in your increase of productivity, okay? So because of that, they may give you a 90-day period where you build up to that productivity standard that they want you to. Show progress every week, okay? And there may be a setback. Maybe there's something that you didn't learn in school or you didn't learn through the workbooks, and then all of a sudden you get in the real world and you're finding that out. And then you have to get used to the providers and their documentation, all right? And when you're getting into the documentation part of it, how do you get to code faster? Well, you need to see what happened for that visit. Why did they come in? What bought the bed? What made them arrive to the hospital? Okay. Then you look at that and you see, is it supported, in the note and that kind of thing. Then you start from there. Then you see all the other diagnoses that were supportive of, what else is going on with that patient. Make sure that you're mindful that you're not picking up symptoms when it's not necessary, when there's a definitive diagnosis, all right? The only time that you're going to be working with any kind of symptoms is when there's no definitive diagnosis, or if it's a sequela situation and you have to pick up the code for the manifestation. That's the only time that you're going to be messing with that kind of stuff. So make sure that you understand what the symptoms are of certain conditions, because that will help speed you up as well. Because if you're looking at let's just say diabetes, and you see that the person says that they have excessive thirst and all this and those, sweating and things like that because their blood sugars are out of control, you're not going to pick up those other symptoms because this is diabetes that's out of control. Hopefully the provider has documented that appropriately so you can select the correct code. But when you're doing that, you'll know, okay, I don't have to waste time picking up that symptom or that symptom. I know that that's part of, a patient who has out of control diabetes, right? And so there's a myriad of other symptoms that, happens with that as well. And of course, you want to look at the documentation to see if there's anything that the provider is putting together for you, as it is. Sometimes they will and sometimes they won't. Sometimes you have to know this stuff, all right? It's the same thing if they have carpal tunnel syndrome and they have numbness. They say that, they're coming in with numbness in their fingers, and then they say, okay, well, it's because they have carpal tunnel. Well, you're not going to pick up the numbness because that's related to the carpal tunnel. Okay, so knowing your pathophysiology is really key in that. Now, I say this because I want y'all to be set up for success. When you are feeling that you're not going fast enough, maybe taking the time in the evenings to review that particular specialty guidelines can kind of help you, or any other information that you can find out about that particular specialty, right? So if you're in the endocrinology clinic and you need to kind of brush up on those types of conditions, that may help you to code a little bit faster, all right? And also, even though you may be working with like the encoder, and the encoder, if you don't know, is an electronic code book. So basically what you do when you're working with an encoder is you're putting in a few words, and then it'll lead you to like a decision tree where you can select other words that can kind of help you to get to the code that you need. So it does make you find codes faster. However, it can lead you to the wrong codes if you answer the questions incorrectly. So sometimes still working with your book may help. And for some people, especially brand new coders, they're actually a little bit faster with the book than they are with the encoder. So it really all depends on you. But what I will say is this. When you understand, like, okay, this is a part of this condition and this is part of this condition, and oh yeah, they take this this medicine, so I'm going to go ahead and pick this up because it's there, you know, that kind of thing. Look at all the things that the provider has to think about when they're caring for this patient. That's how you're going to know what conditions to pick up, all right? You're not going to pick up things that, you know, it's not relevant to that encounter. And that's what you have to kind of think about as well, because a lot of people kind of get hung up on that. They're like, oh, well, you know, I'm picking up all of these things and I'm picking up all of these medications and things like that. Is it relevant to the care of that patient? Ask yourself that. Did the provider have to consider it? That's something that you'll see in the documentation if they documented it, that they had to look at the labs for, you know, the diabetes, or make sure that they have to check the logs for like their blood pressure and things like that. So those are things that, yes, that would be considered as part of the medical decision making and part of that provider's plan for that patient. And knowing all of that can help you to get where you're going much faster, and moving through these records a little bit more efficiently. Okay, and so that's what you want to look at. But don't get overwhelmed thinking, oh my gosh, I got to do all this. Guys, when you're building up to it, it's going to get a lot easier. And yes, there are some that are going to be very intense. So I worked one time for a level 1 trauma hospital, and I worked in the evening. So all of the evening encounters that were left in the queue were the ones that were passed over by the staff that was in the morning time. So there was a lot of hard stuff in the evening. And I was assured that it was going to be a good mix of, you know, difficult and easy charts, so that way, you know, my productivity balanced out. Well, when I started seeing it was nothing but hard stuff and multiple traumas and things like that, I was like, okay, you know, so I had ones that would take me like an hour and a half to code completely, and that was just normal. And so I did let my boss know, hey, you know, this was a situation with this one, and she pulled my productivity, and she's like, wow. She's like, okay, I'm gonna adjust some time for you because that's too much and people are skipping. And she was very upset about that, rightfully so, you know. But with all of that said, if you find yourself like in a situation where, you know, it's really complex, you want to let your supervisor know, so that way they don't think you're just fooling around, you know, just doing nothing willy-nilly, all right? And if you are doing like classes that you are assigned to do for the workplace, then you need to make sure that you're putting that on your productivity report as well, because that's going to take off some of that time. If you are supposed to be coding for 8 hours a day and you spend 2 of those hours doing mandatory classes for your job, I mean, at work, then that's only 6 hours of productivity that you have. So that way, you know, you're not expected to, you know, put out the average of what you would do in a day. It would be a little bit less because of the time that was deducted for the things that they're expecting you to do. So that's something else that you have to know. But getting a lot of practice is really going to help you to get faster when it comes to like how fast you're going and things like that. And again, don't beat yourself up on the ones that you go slow on. I mean, it's better to be correct than incorrect. And it's better to be at a place where they know and understand what we do as coders, because not all places know and understand what we do as coders. And they try to like say, oh, you can do 175, you can do 225, you can do 300, and get out of here with all that. That's data entry. And that's not what you do as a coder. You are not a data entry person. You do data entry as part of what you do, but we also have to look at these records to make sure that everything is absolutely correct. There's a lot of organizations that depend on the information that we produce from these records, right? For statistical reasons and insurance and things like that. So you want to make sure that everything that you're doing is right. And don't go along to get along. If they say, oh yeah, well, this is what we always do here, and we always pick this, make sure that it is correct. And if it is not correct, then you have to speak up. You have to say, well, according to this, this, and this, and if it takes you time, it takes you time. That's just the ethical way to do things, guys. And again, if they're demanding for you to have a really high productivity rate, you need to look for another job seriously, because I would not want to be in a place that would stress me out so bad like that. Now, have I produced 175 in a day? I have personally, because at the time when I was working through those encounters, I was working with a very good group of providers, and everything was on point, on point, on point, on point. And I was doing a lot of the professional fee coding. And so a lot of the things, they were like, okay, everything is jiving, everything's really good. And once you get on a roll, you go and you're on a roll. And so that's okay. I didn't hit that every day, obviously, because then obviously something would be wrong. But I did really good on some of those days, and I was just rocking and rolling. And by the time I knew it, I was like, yes, this is awesome. But again, those days are few and far in between. You're not always going to hit stuff like that. But if you get really good with your providers, that you don't have to query them as much, and everything's rocking and rolling, and you're, everybody's doing what they're supposed to do, it can get like that. However, again, it's not the norm. Okay. So, just make sure that you are looking at why the patient came in. Look at all the other conditions that the provider has documented that affects that condition, and that's how you're going to figure out what else you need to pick up. And when you're looking at like the status codes and like this, the extra informational codes, like for the medications and things like that, like long-term use medications, just make sure that it applies to what's happening for that encounter and what is going on, because that's really where you want to look at. Okay, I can decipher this, I can figure this out. And that's what you really want to have in mind when you're looking at what you're picking up. And don't sit there and go back and forth with yourself. You have to come to a point where you have confidence in what you're doing, because sometimes we will, as coders, there's a meme out there that says anytime it's a peacock, right, with their bright feathers out, and it says what it looks like when coders are questioned on their diagnosis selection or procedure selection or whatever, and it shows this peacock with the feathers out. And that's what we do, because we are very, we take a lot of pride. If you're a really good coder, you take pride in the codes that you select, and you select them for a reason, and you incorporate all of your knowledge and training and things like that. And so when you're doing that, you defend yourself and you defend, your work. But that being said, you have to cut yourself some slack. And when you are out there and you're sitting there overthinking, guys, it's okay to accept what you have said. Okay, I'm going to do this and I'm going to move on. And it's okay. And if something happens and the claim gets rejected and it comes back, it comes back. And then you can work it from there, and you can learn. You can learn from, your mistakes, or you can learn from an audit. If it gets audited and let's just say they pull it and say, oh, wait, that's not correct because it's this and this, then you learn from that mistake and you move on. Okay, you correct it, you move on, and you keep going. All right, and so that's where you want to keep focused on. And again, guys, it gets easier with time, but if you feel like you get distracted easily, you have to kind of watch that, because that's personal responsibility. Now, if you get distracted by your friends coming over and talking to you, if you're at the workplace and you're just like, oh, you know, trying to chit chat, you have to let them know, I have work I have to do. I will be with you at lunchtime or on break time, but right now I have to really concentrate on this. And if they're your friends, they'll understand. And if not, well, then you just upset them, and now they'll really leave you alone, because you know you'll be able to get your work done. Okay, so just think about that when you're doing that. Also, stay off your phone. I've seen coders do this with a straight face, right? With a straight face, they'll say, "Oh, I can't get my productivity done, and you know it's just so high, and they just demand so much from us." Meanwhile, they're like this with their phone on Facebook, Instagram, Twitter, or X, or whatever it's called now. They're on all of these things, and they're with a straight face saying that, or they have their phone going and they're watching a TV show while they're trying to code. No, you can't do that. You can't do that. You can't be on the phone, or they're sitting there talking on the phone. Okay, which is worse, because then you have no consideration for your coworkers when you do that. Okay, I understand emergencies, but take it outside, and don't be right there trying to talk on your phone. I don't care if it's with your kids, because if it's with your kids and it's an emergency, then you need to go. But if it's just oh, what did you eat? Oh, did your sister come home? No, come on, man. No, you need to take that outside and be considerate of your coworkers. It doesn't matter if they have headphones on. Okay, I'm just saying that. So take personal responsibility and make sure that you are actually giving yourself the opportunity to reach that productivity standard in a reasonable manner, and not that, you know, you're sitting here on your phone or being distracted or online shopping when you know you should not be doing that. Okay, there's a time and a place for those things. All right, and again, make sure that you take your breaks, because sometimes that will cause our minds to wander, and then all of a sudden our productivity just goes because we're not taking breaks. It's important to get up. You know, at my facility, we have two 15-minute breaks. We have a 15-minute break in the morning and a 15-minute break in the afternoon, in addition to our lunch. But during my 15-minute breaks, I get up and I go and I get water, or I do what I have to do, and then I come back to my desk. So that way I have something to, like, okay, kind of breaks the monotony, and you're not sitting there staring at your screen all day. Okay, it is important for your health and wellness to get up and move around, and of course to move your eyes around so that you don't get that eye fatigue, because again, you know, if you're not taking care of yourself, it can slow you down as well. So set yourself up for success, and be sure that when you're going through these things, you're not overthinking it, because that's like the worst thing that you can do. There's other encounters that have to be touched. There's other things that have to be done. So you want to make sure that you're being very mindful of those times. All right. And if you find yourself where, you know, in the morning, you're like, man, it's really hard for me to think like really in deep stuff in the morning. Why don't you look at what you have and then do your easier stuff in the morning, so that you can feel like you've made your productivity and get a good bulk of your work done, and then save the afternoon for the harder stuff. Or you can do it the other way. If you're better in the morning, and you know in the afternoon you start feeling sluggish and you need to get those easier encounters done at that time, then just work it that way. There's different ways of setting up your work. For me, it depends on a lot of other factors. But for me, sometimes that's what I have to do. Sometimes I'll work the things that I know I can get through much easier in the morning, so that I have time for my other ones that take a little bit more time in the afternoon. And sometimes it's the opposite. Sometimes I have it in my mind, okay, I need to knock this one out, and I'm going to go through and I'm going to do that first thing in the morning. And then when that gets done, then I feel really relieved, and I'm able to get through the rest of my things. So, you know, with that being said, it's a lot of growing really in the industry. And you will find that with time, all right? But don't beat yourself up. Don't sit there and second guess yourself. Keep it moving, all right? And make sure that you're focused on what you're supposed to be doing. You can say hello to your coworkers, but don't get all distracted and don't let them suck you into, like, you know, talking and doing all these things. And if you see them coming over with pictures and they want to show you pictures, just make sure that you make it very quick and you get back to work, all right? Because setting the tone for why you're there is very important too. All right, with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.